Oh, I see why you need those things.
A little poke. So I'm going to hook up some stem in there. So we're going to run a little electric current through here. I'm going to turn it on. I want you to let me know when you start to feel it.
Okay. Oh, I feel it.
That was pretty instant, wasn't it?
Yeah, this is amazing. And it just sends a pulse to my muscle, right?
Yeah, this entire group of muscles to get that effect. However, in certain cases, especially with like tendinitises and overuse syndromes with certain muscles, it's nice to have a specific approach.
Oh, wow. No pain at all.
New woman.
This is a little tight still, but so much better than it was. A lot of just upper vertebrae issues, neck issues here. I was in a head-on collision with a tractor trailer when I was 9,
Wow.
and broke my, I think I have, it completely destroyed a vertebrae in, I think it's my Y sector, bear with me.
Okay, sure.
But way up here that they actually had to remove, and then I had, I was considered a broken neck, and so a lot of issues there. I was in an upper body halo for like 6 months, and so I had to learn to walk again and things like that, but it was never like I've had direct neck issues because of that.
No numbness, tingling, anything going down the arms like that? It's all pretty localized into that spot?
No, it's pain, but it's not like numbness in my shoulders, and it's mostly like my lower neck, upper kind of back region, and then way down here in the lower back.
Can I press into a few spots?
Yeah, of course.
Here? And is it tender at all? With me pressing in through here, that all feels pretty good?
Yeah.
Okay. There's definitely some fun little imbalances with this high left shoulder.
Oh, I should probably put my feet down.
Okay, cool. Well, let's just start with some ranges of motion. I'm going to have you look all the way over the right shoulder. Any issues with that?
No.
And then looking all the way to the left. Feels pretty good.
Yeah,
look a little bit more restricted going in towards the
Yeah, I
side.
was
Do you
about
feel
to
a
say.
pull on the side when you look over the right shoulder?
Yeah, big pull right here.
Okay. What if you just take the right ear to the right shoulder?
A lot
Same
of
thing.
tension, yeah.
Okay. Over to the left.
Same.
Okay. Chin down to your chest.
Yeah, pain. Not, kind of this throb.
Okay.
Right
All
here.
kind of into that area.
Yeah.
Looking all the way up towards the sky. Any pinches back there?
Yeah. Right about in between my shoulder blades on the upper part.
Okay. Is that right in the middle there?
Yeah.
Okay. Cool. I want to do a few stress tests with you. You can just look straight ahead. I want to put some pressure onto the top of your head. Let me know if that recreates anything.
No.
No. Let's look over to the left and up slightly.
No.
All the way down.
Oh, I can feel it already.
You already feel that?
Yeah.
So me just pushing down.
Yeah.
Where do you feel that?
Right, like middle shoulder. I could almost touch it. Like right here and here.
Just with my hand on top.
No, I think it might be.
Oh, just
it's
with
just
the rotation.
moving it's just this rotation.
Okay. What if we look straight ahead? I'm going to take your head over to the side. If I press down here.
Ooh, lots of tension.
Just like a stretch over here?
Yeah. Mm-hmm.
And that feels okay there?
Mm-hmm.
Okay. I'm going to pull up onto the top of your head here. Relief or pain?
Nothing really. A little relief, like a lift of pressure, but more like up here, not.
Okay. Cool. So we have a lot of fun little spots that I'm mainly going to feel around into with the adjustments. And you've had adjustments in the past. And you've done pretty well with those. Go ahead and go onto your back. I want to just check out a few hip things. So looking up at the
on the
side.
back, that's
Confusion with the
yeah,
table.
it's a little rhetorical, I guess, when the table's bent like that.
Alright, so we're going to pull this back. Any issues in the low back with this?
No.
Okay. Now we're going to bend like here. So crazy range of motion here. No issues with.
Oh man.
And that's what you'd kind of mentioned. Yeah. Most people, a safe degree would be 45. We're way out here. This is maybe 1% of the population.
Great. It makes me feel like all that yoga's worth it. You know?
Well, and so that's good. But you know what we would work to do is be able to control this range. So this is your passive range of motion. So if I let go, can you keep your foot right where it is?
Probably.
Good. So you have really good active range of motion too.
Okay.
So do you feel kind of that cramping sensation into the hips?
Yeah, a little bit. A
little bit of work. So we could work to maybe gain 5-10 degrees, or just work on strengthening that, and that can, you know, if you're doing activity sports, reduce the chances of you having a dislocation in the future.
Oh, great.
That's usually with my hypermobile patients. Our big focus is not on muscle releases, but so this side's a little bit tighter. Do you notice that?
Yeah, absolutely.
But still beyond our normal ranges.
Oh.
Perfect. And I think that's actually just a rotational pattern because you have better external rotation on this side. No issues with that?
No. Tension, like I'm less flexible in that region, but on my left side, but no pain.
Okay, cool. Well, let's get right into it. We'll run through kind of some hip stuff. I'm going to see if there's any imbalances with it. Obviously, we have one side is more mobile than the other, so that can create some cross patterns. Do the adjustments, and then I'm going to kind of make our main focus on the neck. That's what it sounds like. That's the main
that'd be great.
Okay, awesome. Let's go ahead and go face down. Okay. And you've had all styles of adjustments, chiropractic?
Honestly, no. I've only had I've never had that scraping thing before, and
so real quick, just for the camera, if you want to come in a little bit closer. So her left side we showed is a little bit less mobile. This is kind of where they naturally sit. So we're going to work to make that a little bit more even. Do you feel that?
I do.
Okay, cool. I'm sorry, I cut you off a little bit. What were you saying?
Oh, I can't remember. That happens to me all the time. Oh, that does feel great.
Good. And you have a trip coming up. Are you?
Oh yeah. I do a lot of traveling. I go back and forth from Georgia and here.
Are you driving or flying?
I was born and raised. Usually I drive, but this time I actually flew here.
Okay, nice.
Yeah.
Yeah, getting adjustments usually before and after. That's my favorite.
Yeah, right?
There's a lot of chiropractors out in Georgia. Where in Georgia?
Savannah, Georgia. South, yeah. My mom's in Atlanta, so I do a lot of traveling up there, and I know what you mean. There are all kinds of chiropractors up in Georgia. There's some that are a little more spells and witchcraft than others, but...
Yeah, the school that is out there is a little bit on the funny side.
Oh, that's cool. Yeah, they probably have all kinds of new fancy things coming out.
Yeah. Alright, so a little bit of pressure here. But I'm from Nashville, so we're neighbors.
Cool. Wow, great. Yeah, you don't really see a lot of Southerners up here and vice versa. So.
There's about a handful of people I know out here from my hometown. But
oh, really? Well, that's kind of nice, too.
I think a lot of people are staying in Nashville just because it started to become one of those cities like Denver.
I mean, it's coming from someone who's born and raised up here. It's just it's a whole different world than what it was.
Right. Alright, coming into Glute, Medius, and Piriformis. I'm going to place my elbow right here. Now we're going to take this leg out. So with just those two things, let's recheck. Still out a little bit. I think that's going to be a little bit more joint related, so we'll get those adjustments in. So all of this stuff is what you're feeling. All right, go ahead and face me on this side. I'm gonna pull this on here. You comfortable in this position? Great. Go ahead and face that way. It's been a little bit.
Yeah.
You're gonna roll around that way. Sure.
Yeah, I think the last chiropractor I went to was actually right before I left to college, so.
Oh, okay. So it's been a while.
4 years, yeah.
Oh, wow. One more up here. Can I have you look over that shoulder? There you go. Sorry, I had to put some heat on that. Felt pretty good?
Yeah, it felt really good.
So I'm going to have you keep your chin tucked to your chest.
Okay.
You're going to take a big breath in, let that all the way out. And we're going to reset. Wow.
Oh.
There's a lot of tension in there.
Yeah, man.
So that was your spot that basically kept recreating with basically all of your ranges of motion. So we'll recheck that in a minute.
Okay.
When you're comfortable with cervical adjustments. And our hardware is kind of up into our suboccipitals. Is that tender when I press in?
No.
Okay.
Right around where the hardware is was just a little bit, but yeah, like right around
right
there.
here. Okay, let's go ahead and take a few big breaths through there. So you had some paralysis, you said?
Oh, I had nerve damage, and I had some piece of bone was pressing against my spinal something.
Okay.
And I actually couldn't feel below. I had complete numbness in the lower half of my body.
Okay.
And then I was 9, and I went into immediate. I mean, it was immediate surgery, and then.
Okay.
Yeah, I was on the drip in the hospital with a upper body halo for over 6 months.
Wow.
Yeah.
You said you were having difficulty with walking and everything?
Well, no, it was more of just when you're in a bed for that long.
Oh,
like
gotcha.
I just lost my brain didn't remember how to walk anymore.
Right. We'll lose
So.
some of those motor functions.
Yeah, but nerves came back really quickly. I mean, painfully quickly after the surgery. So, and since then, it's been okay. Never any like crazy numbness, and everyone scared me a lot. And they're like, "Oh, you might just randomly stop being able to feel certain things."
Yeah. Well, it sounds like you're super active, and
yeah, I guess that might have been it.
What's gonna keep you away from that?
Yeah.
So we've got a little bit of tension, kind of mid and upper cervical spine. So we're just gonna stay nice and relaxed into the hands here. We'll try to relax that muscle there.
Sounds good. Oh.
Needed.
Yes.
Same deal. Perfect. And then let's actually do Y-strap with you as well. Just to kind of release all of that.
Yeah.
There. Have you had Y-strap adjustment before?
No, it was just that thing that they made us do that was kind of like the Y-strap, but
Just
with
the
our own
cervical
body
traction?
weight. Yeah, but nothing like that.
Go ahead and lift the head up there. Actually, I'm going to pull the hair.
Oh, that's okay.
Perfect. And does that feel comfortable on the cheeks? Okay. We're just going to hang here for a little bit. Does that kind of feel deeper into that spot? Okay. Little boy here. Awesome.
Oh, I see why you need those things. That's kind of cool.
Yeah, it Gets those nice little traction adjustments there. Let's go ahead and sit on up and we'll recheck that with just the adjustments. So we'll run through all those ranges looking right and left.
Yeah, wow.
And then if you take your chin down and up towards the sky. A little bit more open through there.
Yeah, it feels almost more controlled, if that makes sense. Like
Sure.
Stiffer, but kind of where it needs to be.
Okay. So when I repress into here, still pretty tender?
Yeah, that first one that you
here.
went, yeah, that was interesting.
More so over here? Or just kind of both sides?
Yeah.
Okay.
Actually, yeah, I think, yeah, both sides.
Okay. I'm going to have you move your necklaces around to the front, and if you want to come around here, we're going to do a little bit of active release technique. Awesome. So we're going to get right into that place you're talking about. If I can have you bring your chin down to your chest, and let's take it over to the right. Good. And we'll pull this arm across. Doing okay with that pressure? Let's go ahead and come on back. We'll reset. Same deal, chin down. Over to the right. And we'll pull that arm across. Let's actually, so you can feel the difference from one side to the next. Let's do some dry needling over here. And we'll keep with the active release on this side. Have you ever had it in the past?
No.
Are you open to it?
Sure.
Okay.
I'll do anything once at least.
Yeah, let me check in on my time. Oh, perfect on time. I'm actually going to run next door and grab some gloves.
This is the fanciest chair I've ever seen. I've never seen like a pneumatic, electronic
Did we do the
press.
drops with you guys?
Yeah. Or
Not the drops. I've seen some tables that will do that. Like the table will just drop. It's on, and none of it's but none of it's electronic. So that's kind of.
Yeah. So this is like that.
Really
the
interesting.
pneumatics, which is really nice.
Can you just stand in the corner and just have the table drop them?
I still have to put my hands on.
Oh shoot.
There's that little pedal strip on the ground.
Well, I guess you don't want it to take your job or anything. That's good.
I know.
But that's really cool.
Always a big concern. Let's have you go onto your back.
Okay.
So we're going to get kind of into this trap muscle. Perfect. Sorry, it's a little cold.
No, that's okay.
That shoulder down. Good. So 2 things we'll be looking for. We want to feel kind of like a dull, achy feeling.
Okay.
We don't want to feel anything sharp.
Okay.
So if it is sharp, just let me know,
Okay.
and we'll find a new spot for you.
Sounds good.
Perfect. So kind of right in through here.
Yeah.
A little poke. Perfect. How are we doing?
Good.
Alright. So I'm going to hook up some stim in there. So we're going to run a little electric current through here. I'm going to turn it on. I want you to let me know when you start to feel it.
Okay. Oh, I feel it.
That was pretty instant, wasn't it?
Yeah.
Is that manageable?
Yeah.
Okay. So we're going to hang here for a minute. I'm going to turn the frequency up. Kind of feels like a deep little massage.
Yeah, it does.
Okay. So we're going to hang here. It feels really tense until that starts to feel like butter.
Okay.
This is nice on me because I don't have to do as much massage stuff.
Yeah, this is amazing. And it just sends a pulse to my muscle, right?
Yeah, and so it's nice for, certain leg muscles. If we're trying to get into a very specific muscle, we can double check it and make sure that when that muscle is contracting, if we want just the big toe to move.
Wow.
It's kind of a good little recheck.
That seems an incredible resource for you guys.
Yeah, so.
Considering, I mean, it's all just, does it feel here? Do you feel it here?
Yeah, exactly.
And now it's more.
Well, and the newer models of rehab and therapy are moving more towards just fascial lines. So rather than it's this specific muscle, it's this movement that we're trying to get to, so we can hit this entire group of muscles to get that effect. However, in certain cases, especially with like tendinitises and overuse syndromes with certain muscles, it's nice to have a specific approach to it. So.
Yeah. Oh, I see, because sometimes you have to activate certain and also avoid others. And
exactly.
That makes a lot of sense.
Especially when there's nerves and things that we're trying to go around, and arteries, veins, all the fun stuff.
All that jazz, yeah. Seems a little important to avoid.
Perfect. Cool. Take that guy out. All right, all good to go. That's pretty easy, right?
Yeah, that was great.
Cool. So let's go ahead and sit back up. And you can swing the legs around towards that door.
Oh, feels like I just got a massage. Like, it's kind of interesting.
Cool. And this side was a little bit more agitated, it seemed, to begin with. But yeah, that is like butter right there. So let's go ahead and check out those ranges of motion and see how you feel.
Just stand up.
Oh, you can sit there and just kind of look left and right,
do that.
up and down.
Oh, wow. No pain at all.
New woman.
This is a little tight still, but so much better than it was.
Okay, perfect.
Same here. Yeah, really good.
Great. Thanks for watching if you stayed to the end. If you liked the video, do me a huge favor and smash the like button below. And if you're not currently subscribed and you want to see more content like this, go ahead and hit my face button right here so that you don't miss out. I post about 2 videos per week.